Hello, my name is Khushbu Atiwala, and this is the presentation of what I learned in my internship, which is a part of my master's program. So I completed my internship at two places, that is the Sherwood Clinic and Nanda Massage and Physiotherapy Clinic. Okay, so in both the clinics, I started my internship as an observer. Now, in my master's program, I was taught how to effectively conduct an assessment by using the range of motion technique, manual muscle technique, special tests, and I was also taught how to do squat assessment. However, all these techniques I learned was theoretically, and in my master's program, I got a chance to put my theoretical knowledge into practice. The entire internship, most of the times I was observing. However, my supervisor allowed me to manually palpate for the tightness of the muscles, and he also taught me how to assess the tight muscles, how to assess the trigger points, and manually release them. Moreover, this was in general an exciting opportunity for me. In the beginning, in the beginning I was very tensed and nervous. I was not under control and I did not know how to effectively communicate with the clients. But as the weeks and days passed by, I gained more self-confidence, and I learned how to properly carry out an assessment. And most of the exercises my supervisor used to plan, and then I used to back those exercises with the help of evidence. Okay, the second part of my presentation is the case study. So my client's name was Kushtandale. Date of birth is 17/6/1996. So she's 27 years old. She was approximately 160 centimeters in height. Now she works as a receptionist at the Pure Gym. So her most of the time at workplace consists of sitting in one place. She works out once a week at the gym, and occasionally she goes for a morning or an evening run. Otherwise, she leads a very inactive life in general. So when she first came to us, I asked her that what her goals were, to which she told me that she wanted to improve her overall mobility and flexibility, wanted to prevent injuries, and in general, she wanted to work on her overall strength and wanted to increase the strength. The client came to us because she was facing periodical back pain since last 5 months, and she told us that she was feeling more stiff in the morning. Her pain rating scale was from 6 to 7 on 10. Now I only saw the client twice a week. So in the first session, the PT assessed the range of motion of lumbar spine, shoulder and hip, and he also did manual muscle testing of lumbar spine, shoulder, hip, and the abdominal group of muscles. In the special test, he performed modified Schober's test. I asked him that why would he perform modified Schober's test, to which he told me that he wanted to know if there is a decrease in the lumbar flexion range of motion. In addition to it, he performed Faber's test because along with chronic low back pain, associated problems are there with the sacroiliac joint dysfunction and hip pathologies. So he wanted to rule out that. And piriformis test was to check for piriformis muscle tightness, which can also lead to the low back pain. Moreover, I just suggested once to check for the presence of Trendelenburg sign, because gluteus medius weakness is many a times associated with the lower back pain. So the positive findings of the assessment were that the modified Schober's test was positive because there was less than 5 centimeter increase on the inch tape when the client was performing lumbar flexion. Piriformis test came out positive because there was pain in the gluteal area and the posterior aspect of the thigh. However, the PT also did manual palpation to check for the trigger points in the gluteal region, because if the person is facing lower back pain since a long time, then because of the pain and because of the pain there could be trigger points formed in the gluteal region. So there was one taut band, and there was a taut band along with one active trigger point in the right glute, and the Trendelenburg sign also came out positive because the gluteus medius because of the weakness of the gluteus medius muscle. The positive findings for the range of motion were that the lumbar flexion actively was only 40 degrees. For the hip flexors group of muscle, actively it was 70 and 75 for right and left respectively, and 100 and 115 degrees for right and left respectively. Hip external rotators was actively 35-30 for right and left respectively, and full range of motion passively. For hip abductors, for actively it was 35 and 40 for right and the left, and full range of motion passively. And for the shoulder extensor group of muscles, it was nearly full range of motion except for the right side actively. And coming to the manual muscle testing, it was grade 3, and for the core also it was grade 3. In the first session, after the assessment, the PT only released the trigger point by ischemic pressure release method. I asked him that why did he choose ischemic pressure release method. So he told me that this is with the help of this method there is immediate reduction in the pain, and he also released the hamstrings, piriformis, and the lower back muscles with the help of massage. He used Effleurage and the kneading technique. Static stretching was given to the hamstrings, piriformis, and iliotibial band. A single stretch was given for each of the muscles with a 30 seconds hold, and iliotibial band shortness is associated with lower back pain. Hence, stretching of the iliotibial band was also given in order to increase the length of the muscle. After this, the patient was taught the self-stretching for hamstrings, piriformis, and iliotibial band group of muscles, and was advised to follow the stretching protocol at home as to how it was given in the clinic. For the second session, the patient came to the clinic after 1 week, and my supervisor asked me what different I would do, to which I said that I was taught how to do squat assessment in my master's program, so I put that into practice. So in the lateral view, positive findings, I found that the lower back was arching in the client. So the overactive muscles are the hip flexor group of muscles, erector spinae, and the latissimus dorsi, and the underactive muscles are the gluteus maximus, hamstring, and the core muscles. And in the upper body, I could see that the arms were slightly falling forward, which means that the overactive muscles are latissimus dorsi, pectoralis major and minor, and the coracobrachialis group of muscles. And the underactive muscles are the middle and the lower trapezius, rhomboids, rotator cuff, and the posterior deltoid group of muscles. In the single leg squat, her knees were going into valgus, which means that her knees were moving inward. So the overactive muscles were the adductor group of muscles, biceps femoris, short head, lateral gastrocnemius, and the vastus lateralis. And the underactive group of muscles were the medial hamstrings, medial gastrocnemius, gluteus medius and the maximus, and vastus medialis obliquus. After the squat assessment, my supervisor checked for the range of motion assessment and the manual muscle testing. So we were able to achieve a good range with the lumbar flexion, good range with the hip flexor group of muscles, and a nearly full range of motion was achieved with hip flexors, hip external rotation, hip abductors, and the shoulder extensors. In the manual muscle testing, the lumbar flexors, hip flexors, external rotators, and abductors, the grade 4 was achieved, and on the Oxford scale, and for the core it was still grade 3 because the client was not able to clear off the table. In the second session, foam rolling was given to hamstring, adductors, and the glutes group of muscles, because foam rolling is a common myofascial release method used to increase the range of motion. For the activation of core and the glutes, clamshell 2 sets into 5 repetitions, and glute bridge again 2 sets into 5 repetitions was given. Moreover, the patient was asked to do the above exercises at home, and in addition to it, the patient was also advised to do heat application for 5 minutes after doing home exercises, because heat application also helps in reducing chronic pain. For the third session, the patient came after 10 days. So when we asked that what went well and what did not go well, to which she said that her pain had considerably reduced from 6-7 on the scale of 10 to 2-3. However, she was facing difficulties with the exercises which were given to her in holding the exercises for the certain amount of time. So based on the assessment till now, the goals were set to improve the lumbar and hip range of motion, to work on the core and the glute strength, to work on the hip strength and the mobility, and in general improve the stability and proprioception. Now this was the exercise program which was designed for the client in the third and the fourth session. However, in the third session, only the warm-up and the activation group of exercises were given. So for the warm-up, foam rolling was given to the hamstrings, adductors and the latissimus dorsi group of muscles. Single set was given for 30 seconds hold. PNF was given, peripheral neuromuscular facilitation, to the iliotibial band, piriformis, hamstrings and glutes group of muscles, and a single set was given. This was to increase the range of motion of the muscles. Self-stretching was taught to the patient for the deltoid, trapezius and latissimus dorsi group of muscles, and a single set was given for 30 seconds hold, and this was for the upper body activation, so that when the patient does follows these exercises at home, she can include more of upper body as well. Then for the activation, clamshell was given. Now only a single set was given, because last time the client was struggling with the complaint that she was struggling with the exercises. So single set was given for 5 repetitions, and the tempo was set as 4, 3 and 1. This was to get the more of gluteus medius and maximus activation. In the last session, the client was only given a regular glute bridge. So this time a band was added to modify the exercise. So banded glute bridge was given with a single set and 5 seconds hold. So 5 repetitions, and the tempo was set as 4, 1 and 1. This was for core activation. Now to add more of upper body in the exercise, biceps curl was given with 2 kg. A single set was given for 5 repetitions, and the tempo was set as 4, 1 and 1. For the skill development, bird dog was given for 2 repetitions with 5 seconds hold and 60 seconds rest in between. This was to work more on the core stabilization, because if the core is stabilized, then a stabilized core helps in improving and maintaining the lumbopelvic rhythm, and this in general helps to reduce the pain which is associated with the lower back. Resisted ankle dorsiflexion was given 2 sets with a 5 seconds hold, and for 60 seconds rest in between was given. This was to stimulate the lower body muscles, so that in general we can work for the trunk balance and the proprioception. For the resistance training, single leg balance reach multiplanar was given. 2 sets were given with 5 repetitions. This was to improve the trunk balance. Plank was given in the resistance training. However, only 1 set was given with a 3 seconds hold. This was to improve the core and the glutes strengthening, because we wanted to work on the core and the glute strength as well. And at the end, resisted hip movements with the help of band was given for flexion, extension, internal and external rotation. 2 sets were given for 5 repetitions, and 5 seconds hold was given. However, rest was given in between the 2 sets for 30 seconds. This was to work on the hip strengthening. After the program, my supervisor also wanted to work on the lower body more by adding drop jump. However, he said that he can add in the following sessions depending on how much is the pain of the patient. Okay, thank you.